Hello everyone, Kirk Weber again from Weber Chiropractic out here in Fenelton, Pennsylvania. And I'm coming to you today with another health topic video that I'd like to talk to you about. This is one that I see frequently in the office. I'd say on average, probably every other day since I opened the office in 1980. It's one of those things that is not really anything that is being done by a patient that is in any way anything to do with what they're thinking that is wrong. What they're thinking is exactly right. Patients are thinking in terms of what they have been exposed to, what they've been taught. And right now I'm sure you're pretty confused. So let me set this scenario up a little bit by giving you an example as to how it happens in my office, and then we'll go from there. What happens is, let's say Mrs. Smith shows up at Dr. Jones's office, and she has a spinal pain, and Mrs. Smith gives a history of the pain to Dr. Jones. Dr. Jones performs his physical examination, his orthopedic tests, his neurologic tests. He does a history, he does a familial history, he goes through the whole thing and orthopedic tests, the whole deal. And afterwards he gives a presentation to Mrs. Smith as to what he thinks is wrong, what he thinks needs to be done, how long it's going to take, and what he's going to try to accomplish. And Mrs. Smith looks at him and says, "Well, Dr. Jones, is there anything out?" Now, Mrs. Smith has done and said absolutely nothing wrong. To many chiropractors, and particularly young chiropractors who just got done putting in years of education, might become a bit frustrated as they hear that question, because they have just spent an inordinate amount of time with the patient explaining in great painstaking detail what has transpired. So I can see both points of view. And I have an advantage as in having come from a chiropractic family as a second generation chiropractor. I hear this, is it out in my office all the time. I know exactly what the patient means. Okay, this was something that was used as a means of describing what chiropractors do by previous generations of chiropractors, and they wanted to do it in a simple, efficient manner so that the patient could, grasp this. They wanted to get the idea across quickly and let's move on. And I think that's great. I think the concept still works, and I think it still should be used. But I also think that you, the patient, deserve to know a little more detail as to what is going on, because that will give you some insight as to what it is we are trying to do and how we're thinking as chiropractors. So with that in mind, what I'd like to do is take a few moments and kind of go through with you a little bit as to how this all sets up from my perspective. Now, it's going to require us to do some a little bit of neuroanatomy and a little bit of discussion with some terms that may be unfamiliar and uncomfortable for you. I'll do my best to make them comfortable, but once you see and understand what it is we're doing, I think the whole thing will come clear. Now, I'm going to try to use some visual aids for you and show you what we are trying to do. The vertebra in the spine, and here's my model, all right, have a portion here that's known as the body. In between the two bodies of the vertebra is the disc. Body, disc, body. All right? That disc is there to act as a shock absorber. If you jump off of something, it absorbs that between the vertebrae so they don't bang into each other. It allows for a little extra mobility in the vertebra as well. Now, the next part of the vertebra are these pieces out here. All right, sticking up this way, sticking off here, and we'll try to give you a little different view on it. All right. Those pieces, that part of the vertebra, back here, all of this, is known as the motor unit. And again, you see these pieces here, these guys here and here, they're there for muscle attachment. That's kind of why they stick out like little fins. A muscle pulls on that, and as it pulls on it, it can direct the vertebra to move in one direction or another. So we have the body and the motor unit. And in between, where you see that yellow, it's actually a hole. All right, that is for the spinal cord. The spinal cord hanging from your brain all the way down through the vertebra and connecting and giving a pathway for the nerves to come off out between the vertebra like so. Now, if you look real close here, we'll bring this in a bit so you can see. You see here that the hole where that nerve comes out of, that's called an intervertebral foramen. How's that? All right, let's break it down. Inter, between, vertebral, vertebra. Yeah. Foramen, that's kind of a doctor term for hole. So we have a hole between the vertebrae. Pretty simple. Guess what kind of nerve this is? Yep, intervertebral. Guess what kind of artery runs through that hole? Intervertebral. Guess what kind of vein? Intervertebral. And fat pad, intervertebral. Okay, you got it. Look at what makes up the boundaries of that foramen. Part of the disc, part of the vertebra above, part of the vertebra below, and then back here, these pieces here. See? Those pieces, which I'll show you here, those are facets. Now, a facet is, again, doctor term for part of a joint. So, here we have the facet sticking down from the vertebra above is coming into contact with the facet sticking up from the vertebra below. We have two facets per vertebra, here and here, that stick down, and here that stick up. So the two that are on the bottom come in contact with the two coming up from the top of the motor unit up below. When those two come together, they make a facet joint. So now you have the facet joint is the back part of the entire surrounding of the foramen. Okay, now we're kind of working with the terms. We know what we're looking at. I need you to picture in your mind a force coming across this spine like my hand, hitting that vertebra and moving it that way, enough that it breaks those joints and slides the vertebra, let's see if I can do it, clear over to here. All right, let's look at what would happen. Well, we're going to cut the spinal cord. We're going to rip and tear the intervertebral nerves. We're going to damage the disc. All right, pretty severe injury. Paralysis at the very least. That injury is known as a luxation. Again, a fancy doctor term for dislocation. A vertebra out of place. Now, chiropractors deal with subluxations. Sub meaning under, lesser, smaller, small misalignments. if we look at that foramen and we move that vertebra ever so little, you see how the foramen changes size and shape. So if we have a vertebra subluxated, just out of place a little bit, we change the shape of the intervertebral foramen. Now we're putting pressure on the fat pads and the intervertebral artery and the intervertebral vein and the intervertebral nerve. That nerve then is being interfered with in its ability to transmit signals to a distal point, efferent nerves, or a nerve bringing a signal back from a distal point to the brain, an afferent nerve. You're going to sense it as discomfort or pain or an impaired ability to do something such as move a muscle. So that's what chiropractic, that's the premise as to what we are doing. Some chiropractors believe the subluxation is the entire root of the problem. And it may well be. I'm not going to argue that point. I'm just pointing it out that that's how some people feel. Personally, myself, I'm more comfortable feeling that the subluxation may or may not be the entire deal. It may be a symptom of something else going on. For example, if I had arthritis in this joint, all right, I'm going to definitely have spurs that could grow up into that. That's going to cause a certain amount of discomfort or pain. That's going to cause the vertebra to move in a different direction. It's going to cause it to subluxate, move away from that pain. If we have an extra muscle pull on one side or the other, all of these different things will cause subluxations. My job as a chiropractor is to determine what those causes are. Then my job as a chiropractor is to immediately stop the pain, reduce the cause of the pain, and then restore normal function to you. So, is it out? Yeah, it's out. And does putting it back in make it better? Yes, it does. But as you now know, there's a lot more to the story than just a vertebra that's out. So at any rate, I hope this was helpful for you. We try to explain these things to our patients so that they have a better understanding as well, because this is the launching point for what we're going to do here in the office, as well as things that you can do at home. So until next time, this is Kirk Weber saying so long. Have a great day, folks. We'll see you later. Bye-bye.